Today, we'll talk on a very rare remedy but rampantly used Calcarea silicata. I am Dr. Milind, practicing in Pune, Satara since 28 years. Calcarea silicata is used very rampantly in the practice of homeopathy, but still the known facts of Calcarea silicata are not known properly to the general practitioners and even the homeopathic practitioners. I first will tell you Calcarea silicata is a salt. It's a combination of two remedies, Calcarea carb and silica. Probably I'm not aware of, but Kent was the first person who proved it, and very little documentation was done on Calcarea silicata. And as per the symptoms of Calcarea carb and silica, it is prescribed what I see in many of the homeopathics who are practicing. We will present a picture of Calcarea silicata in a very classical way, which type we have given in our Matra Medica, means mind section to the extremity section and the relationship of the remedies. Calcarea silicata being a salt, it is a very chilly remedy. It has a very marked action on all the systems from mind section till the extremity, till the skin, the mucocutaneous junction. It is having a clear cut proving on all the systems. Coming to the mind section of Calcarea silicata, this remedy is having a great refinement. A refinement in the sense of protection. I need security. I need protection. I need some, if external harm is there, he is insecure. This type of security, it has all types of anxiety, but anxiety and the protection part is always in the sense of his own position in the society. He has lack of confidence, he has the marked apprehension like gelsemium, lycopodium, nux vomica, but it is because of his own position. I'll give an example. A baby in a womb, if he is Calcarea silicata, he is insecure in the way that how I am growing. I comes, and here Calcarea silicata grow well in the womb, but the fontanelles are open. Some malnourished symptoms can uproot during 6th or 7th month of that lady. I am talking of Calcarea silicata in a womb. When a child comes out, of a calcareous silicata, he might present a open fontanelles, cyanosis, which is central cyanosis is there, and the symptoms he will give of chilliness. He's sensitive to all external impressions. The external impressions might be in the humor, might be in a hypochondrial level, or physical. And this way, calcareous silicata is born with all anticipations and sensitiveness in his mind. When he grows with this problem, but when a homeopath points out such important factors like oversensitiveness, you can compare heparsulf, you can compare calcarea, you can compare silica, you can compare even arsenic album. These have a cross remedies with calcareous silicata. You can even compare all the salts, sea remedies with calcareous silicata. Coming to the head portion, calcareous silicata is oversensitive to every draft of air, change of temperature. He will have headache, usually on vertex, which is piercing. Most of the pains of calcareous silicata are piercing. In scalp region, he will have all types of pains, but usually piercing pain, which is aggravated during change of temperature. Change of temperature, usually I have seen in my practice, calcareous silicata works well in cold draft of air which comes from first strains. He's better by warmth. These are head symptoms. Coming to the nose, they have posterior nair polyps, which usually aggravates during change of temperature, cold climate, better by warmth, better by stocking, and they are mostly aggravated during sleep. Calcareous silicata, when no symptom comes, they cannot sleep properly. You can compare nux vomica, you can compare aurum triphyllum, not Ilium cepa, aurum triphyllum in such cases. In eyes, refractory errors, it has cured, like the cases of cataract, premature cataract in the first stage. If you look with the help of the eye specialist, you will see the immaturity, which is just 10 to 15% in the lens. But comparing the all totality of symptom, you may give calcareous silicata. I have many patients where calcareous silicata has abandoned the further growth of cataract. Talking about the throat symptom, hoarseness of voice, soreness of voice, usually in the morning hawking up. It has Calcarea silicata has a typical what we should say typical way of expressing he has some pain in throat which is usually piercing and he hawks. Coming again to the chest part, it has a very sticky, thick cuff. You can apply all the modalities which I told you previously. Change of temperature, usually in rainy season, first rain season, sensitiveness, sensitive in mind and body, everything. Again to the rectum part. I'm coming now to the stomach part. Eructations usually in these Calcarea silicata patients are of the food that they eat. They are heavy eaters. They have ravenous hunger. Ravenous. It is written in Kent's Matra Medica. If I am thirsty, I will drink the well dry. It comes in thirst part, but here it comes in Calcarea silicata like of stomach. But he has a problem. If I will do this, I will have stomach problem. So it's less. But the tendency of Calcarea silicata is to grow. But he has a fear, he has apprehension in all parts. Anticipation is the best word. Anticipation in stomach is the best word. Coming to the skin part of Calcarea silicata has a pustular which looks like silica, means they are having pustular but they have a crusty formation. That type of eruptions are seen. I have used Calcarea silicata many a times in dry eczemas, wet eczemas. If the totality matches, wet eczema giving after Calcarea silicata has dried up, and then I go for the newer set of symptoms which usually comes C remedy. You can compare in skin cases Natrum muraticum with Calcarea silicata, sepia, silica. There are various drugs which comes from the series of salts and from C, especially in C. It cures in the rectum region. It cures fistula in ano, fissures in ano. But the symptoms are to be pointed out, interrogated properly, then you can think of Calcarea silicata. Calcarea silicata is usually during eye symptoms, in eyes, I have seen many cases where the symptoms agree, Calcarea silicata, when given in a higher potency, rectifies the refractory error, but it has to be given in higher potency. Talking about the rectal region which I was talking of, calcarea silicata is having a typical mucocutaneous junctional problems. Fistula in ano, hemorrhoids. Hemorrhoids are usually bland. Fissures. In fissures, usually right side, the what surgeon says 12, 3, 6, 9. Usually it is at 9, which calcarea silicata cures. That is my experience. I am not vouching this. That is my experience where I have used calcarea silicata properly, with proper case, with proper interrogation with the patient. If you find exactness of chilliness, excessive, internal, external, any form of anxiety, you can think of calcarea silicata, which you can miss in your practice. To cure the case. The sensitiveness of calcarea silicata is very important, and that is not being given in Matra Medicas, which I told you. And these things in extremity, it has some callosities, it has cured calcaneum spurs. I don't have any experience of using calcarea silicata in rheumatoid arthritis, but it may help, because if calcaneum spur can be cured by calcarea silicata, it is useful. Usually calcarea silicata, in my experience of practice, I have seen it acts in cleavage of miasms. Cleavage of miasms, I'll tell you in very short. Cleavage of miasms. What is cleavage of miasms? When two miasms come together, you should think of which is acting, which is dominant miasm, latent miasm. It is given in our Matra Medicas, but in our philosophy it is given. Hahnemann has given about cleavage, how Sora comes to Sora turns to syphilis, Sora turns to psychosis. Some people say calcarea silicata is a ringworm miasm. I am doubtful about calcarea silicata has a ringworm miasm. But basic miasms where I will fit calcarea silicata is sorosyphilitic. And you have to feel how. The second part of this drug is that it works well like nosode. In our Matra Medicas, various drugs are being given in relationships, that to complete a case of such and such, if the case is proper and the cure is not attained, so to complete the case, this remedy can be used. you can think of calcarea silicata where the best indicated drug fails to act. Usually the best indicated drug is calcarea carb, silica, natrum mur, lycopodium, sepia. Don't forget sepia to compare with calcarea silicata. And I will tell I will tell you the magical flora of calcarea silicata. Calcarea silicata has a very mild, in talking of ragas. Raga is music. They like light ragas. They don't go for higher tunes. They don't go above 4. They are very maintained. But the apprehension of calcarea silicata is marked. I'll tell you the cases where I had used calcarea silicata in these experience of practice. I've used calcarea silicata in autistic cases, autism, slow learners, fissures and fissulas, mucocutaneous junction, and in this region, the sepia is here, sepia cracked in between is sepia. Usually at a particular weather. If a person comes with cracked middle lip, middle this, lower is sepia, cracked over here, usually in rainy season, is calcarea silicata in higher potency. The potency of calcarea silicata in pathological way, in pathological cases, you can go 200 to 50 millisiemen first or third potency, but in very grave cases or in very old cases, use calcarea silicata in a very higher potency, more than 1 m. Repetition of calcarea silicata, it might be repeated twice, thrice. In any potency you can repeat. Repetition, no law, no rules. It depends upon the physician. Selection of potencies also depends upon the physician. According to the case, it is relationship with calcarea silicata. Calcarea silicata helps well to complete the case of calcarea, silica, nux vomica, lycopodium, jalsemium, usually all salt remedies, sepia, right. Various things I have covered. Cons, I even used calcarea silicata in con cases. I don't give any combinations, so I practice in Hahnemann way. So to complete and conclude, I think this knowledge will help you in your practice. Please like my channel and subscribe it. I'm giving various methods of practice, and I will give various tips of practice in further videos. Thank you.